Everyone is on the skinny shot, the GLP-1s, the semaglutides, the tirzepatides. The next question people always ask me is, all right, I've lost all this weight. What should I do for plastic surgery? Now, that's always going to be different for each individual person, but I hope to give you a roadmap to at least answer some questions. So the skinny shot's actually really crazy. We are consistently seeing people who've lost 20 or 30 pounds. Like, that's not even a question anymore. We are frequently seeing people who've lost 50, 60, 70, 80 pounds, numbers that we're not really even feasible couple years ago. And so the question next becomes, okay, I've lost all this weight. How should I think about, like, what do I want to do? I want to do that next phase of my rejuvenation or my plan or my journey. All right, I think the most obvious thing is, yep, you've got excess skin. We need to get rid of that excess loose tissue. And that's always going to be number one. And commonly for us, this means tummy tucks, but most people now, when they lose that much weight, I think once you lose about 50 to 60 pounds, you're going to at least start to look at full body lifts. You may not need it, but it's something that you should at least look into, because when we have that degree of weight loss, we may need that body lift. This is very interesting in plastic surgery. While we didn't do body lifts, I would say very commonly they were done. With the additions of the skinny shot, we are now doing body lifts all the time because so many people are losing so much weight and getting themselves on a more healthy path. And I think that's awesome. The next thing I think that comes is sort of shape. And what do I mean by shape? Well, everyone will still have a little bit of fat in certain places, right? So once we remove that skin, it's kind of pulled down nice and tight, we want to create a shape. And we can create that shape by going in and selectively liposuctioning that little bits of fat that are still there to help create a little bit of sort of definition and difference to help give you that shape back. And finally, we want to think about structural support. And what do I mean by structural support? The face is one of the best examples. I think everybody can instinctively think of, oh, I need a face lift because I've lost so much weight. Oh, I may need some more volume put back in my face because my face looks thinner. But the other thing that we can do is we can actually create more structural support or pillars with that volume that we're putting in to give more longer lasting and more youthful results. So that's sort of the plastic surgery plan from the skinny shot. Remove the skin, improve the shape, create a structural support system.